The role of empathy and authenticity. In the intricate tapestry of therapeutic practice, empathy and authenticity emerge as pivotal threads, weaving together the complex relationship between therapist and client. These elements transcend mere skills or techniques. They form the essence of a therapeutic partnership grounded in genuine human connection. Understanding the nuanced role of empathy and authenticity requires delving into sophisticated theoretical frameworks, analyzing competing perspectives, and exploring actionable strategies for implementation. This lesson seeks to provide a comprehensive examination of empathy and authenticity within the therapeutic context, offering insights applicable across varying sectors and enriching the therapeutic alliance. At the heart of therapeutic practice lies the concept of empathy, which encompasses both cognitive and affective dimensions. Cognitive empathy involves the capacity to understand the client's perspective and emotions, while affective empathy refers to the ability to emotionally resonate with the client. These elements work in tandem to create a space where clients feel seen, heard, and understood. Theoretical models, such as Carl Rogers' person-centered approach, emphasize the importance of empathy as a core condition for effective therapy. Rogers posited that empathy, alongside unconditional positive regard and congruence, facilitates a therapeutic environment conducive to self-exploration and growth. This foundational perspective underscores empathy as both a relational process and an experiential encounter, inviting therapists to engage deeply with clients' realities. However, the practice of empathy is not without its challenges and critiques. Some contemporary scholars argue that an overemphasis on empathy can lead to emotional burnout or blurred boundaries, potentially detracting from the objectivity required in therapeutic settings. Others suggest that empathy, when unaccompanied by action or intervention, might fall short of fostering meaningful change. These critiques invite a reevaluation of empathy, advocating for a balanced approach that integrates empathic understanding with strategic therapeutic interventions. Authenticity, a concept closely intertwined with empathy, presents another cornerstone of effective therapeutic practice. Authenticity involves a congruence between the therapist's internal experiences and external expressions, fostering a genuine and transparent interaction with the client. The work of existential and humanistic theorists, such as Irvin Yalom and Rollo May, highlights the transformative power of authenticity in therapy. They argue that when therapists bring their authentic selves into the therapeutic space, they model vulnerability and courage, encouraging clients to embark on their own journeys of self-discovery and authenticity. Despite its celebrated status, authenticity is subject to critical examination and debate. Some critics caution against the potential risks of excessive self-disclosure or the inadvertent imposition of the therapist's values onto the client. The challenge lies in finding a delicate equilibrium where the therapist's authenticity enhances the therapeutic process without overshadowing the client's needs or experiences. This tension invites therapists to engage in ongoing self-reflection and supervision, cultivating an awareness of their motivations and biases. Pause. Integrating empathy and authenticity into therapeutic practice requires actionable strategies and frameworks that transcend theoretical discourse. One such approach involves the deliberate cultivation of presence, a state of mindful awareness and attentiveness that allows therapists to attune to clients' verbal and nonverbal cues. Presence, as articulated by mindfulness-based interventions, enhances the therapist's capacity for empathy and authenticity by fostering a non-judgmental, accepting stance. By incorporating mindfulness practices into their routine, therapists can enhance their ability to remain grounded and responsive in the therapeutic encounter. Moreover, the therapeutic application of empathy and authenticity can be enriched through the use of narrative therapy techniques. Narrative therapy, pioneered by Michael White and David Epstein, views individuals as the authors of their own stories, inviting them to re-author narratives that align with their values and aspirations. By adopting a narrative approach, therapists can facilitate a collaborative exploration of clients' lived experiences, fostering a sense of agency and empowerment. This process is inherently empathic and authentic, as it requires therapists to engage with the client's narrative while simultaneously honoring their own authenticity. Typos, the process. The exploration of empathy and authenticity would be incomplete without considering interdisciplinary and contextual influences that shape their practice. Drawing connections across fields such as neuroscience, social psychology, and cultural studies provides a richer understanding of these constructs. Neuroscientific research, for example, offers insights into the neural correlates of empathy, highlighting the role of mirror neurons in facilitating empathic responses. These findings underscore the biological underpinnings of empathy, reinforcing its significance as a fundamental aspect of human nature. Cultural considerations further complicate the practice of empathy and authenticity, as cultural norms and values influence how these concepts are understood and expressed. In cross-cultural therapeutic settings, therapists must navigate the complexities of cultural empathy, an awareness of, and sensitivity to cultural differences. This requires adopting a culturally responsive approach that acknowledges and respects diverse cultural narratives, adapting therapeutic interventions to align with clients' cultural contexts. To illustrate the application of empathy and authenticity across different sectors, consider the following two in-depth case studies. The first case study examines the role of empathy and authenticity in trauma-informed therapy. A therapist working with survivors of trauma must navigate the delicate balance between empathic attunement and maintaining a safe therapeutic boundary. By employing trauma-informed practices such as grounding techniques and psychoeducation, the therapist can create a supportive environment where clients feel empowered to process their experiences. Authenticity, in this context, involves the therapist's willingness to engage with their own emotional responses to the trauma narrative, modeling resilience and openness. A second case study explores empathy and authenticity within the realm of organizational consulting. In this setting, consultants are tasked with facilitating change and enhancing organizational dynamics. Empathy and authenticity become crucial tools for building trust and rapport with clients, enabling consultants to understand the unique challenges faced by individuals and teams. By authentically engaging with stakeholders and demonstrating genuine concern for their perspectives, consultants can foster a collaborative atmosphere conducive to meaningful organizational transformation. In conclusion, the intricate interplay of empathy and authenticity within therapeutic practice underscores their indispensable role in cultivating a healing relationship. Through advanced theoretical insights, actionable strategies, and interdisciplinary considerations, this lesson has sought to illuminate the multifaceted nature of these constructs. By embracing the complexities and tensions inherent in empathy and authenticity, they can enhance their practice and contribute to the broader discourse on therapeutic partnership. As we continue to explore emerging frameworks and novel case studies, the journey of understanding and embodying empathy and authenticity remains a dynamic and evolving endeavor. Pause.